Indian population colon and rectal cancer and എണ്ണം കൂടി വരികയാണ്. But the good news is that early detection and advanced treatment we can save the lives. പ്രിയ പ്രേക്ഷകർക്ക് മെഡിട്രാക്കിലേക്ക് സ്വാഗതം. ഇന്ന് മെഡിട്രാക്കിൽ നമുക്ക് അതിഥിയായിട്ടുള്ളത് മാംഗ്ലൂർ AJ ഹോസ്പിറ്റലിലെ ഓങ്കോ സർജൻ ഡോക്ടർ വിശ്വനാഥ് ആണ്. സർ, വെൽക്കം. As he said, today this episode we are going to discussing about colon cancer. What is colon cancer? Colon and rectal cancer and its symptoms, it is the diagnosis, treatment, any preventive method, all these things. Okay, sir, before that directly I am going to ask one question, sir. Exactly, what is colon and rectal cancer?
Yeah, as we know, colon is one of the integral part of the digestive system of the body.
Okay.
Whatever we eat from the oral cavity,
Okay.
it's get digested, and the last system which digests is the colon and the rectum.
Okay.
So if you look at the anatomy, colon has got multiple parts like right colon or the cecum ascending colon is called the right colon.
Okay.
And transverse colon, the left colon, sigmoid and the rectum. So
Okay.
these are different parts of the colon.
Okay.
So if there is any abnormal growth in the lining or the mucosa of this intestine, large intestine, basically that is diagnosed as colon cancer.
Okay.
If it occurs in the rectum, it's diagnosed as rectal cancer.
Okay.
So any abnormal growth in the mucosa of the lining of the large intestine is colon cancer.
Okay.
And in the last part of the colon is the rectum.
Okay.
So that's called as rectal cancer.
Okay. See, as concerned about the Indian population, what is the case? What is the status of this? Is it rising or decreasing or increasing these cases?
Of late, India is seeing an increase in the trend in colon cancer. Past, it was the disease of the West.
Okay.
Most of the colon cancers were diagnosed in the Europe and Americans. If you look
Okay.
at the data from IARC,
Okay.
International Agency of Cancer Research,
Okay.
or the Globocan data, so they every year they put for their numbers. So if you see the numbers worldwide, it's around 1.9 million people are diagnosed by colon and rectum every year in the world.
Okay.
Majority are in the Europe and the America. India it was less.
Okay.
But of late, because of this westernization of our lifestyle, the diet habits and sedentary lifestyle and all those things, India is seeing a surge in this colon cancer in the young population also.
Okay.
So Indian data says around 7 to 8 lakhs new cases are diagnosed every year of colon and rectum put
Okay.
together. Out of which 35 to 40,000 die because of colon cancer.
Okay.
Unfortunate, because they come late. They come in
Okay.
stage 3, stage 4. So around 40,000 cases annually they die because of colorectal cancers.
Okay, because
Very
of-
alarming.
Okay. That because of fourth stage and
Because they come late.
Okay.
Because these patients present late to us in stage 3 or stage 4.
okay.
So majority of the stage 4 patient we know we cannot cure
Okay, sir.
as of now.
Yes.
So with whatever therapy or chemotherapy, targeted immunotherapy, whatever it is, we can prolong the lifespan by weeks to months, sometime a year or two, but we can't cure them. So
Okay.
the most unfortunate thing, what we can prevent is pick up these patients at a young, at early stage.
Okay.
Young patients at an early stage. Stage 1 cure rates are 90 to 95%.
Okay. Early
And-
detection is better, is it?
Pardon?
Early detection for
Definitely.
any disease.
Any cancer in the body, you
Yeah.
cannot prevent, but if you can pick up early, you can cure
Okay.
majority of them.
Then we can save the lives.
Definitely.
Okay, so we will go through that section details, sir. So before that, the main causes is already told. What it is because of diet, our daily life
Yeah,
routine.
if
That's
you-
why in India, especially young generation, getting more.
Correct. If you see, for any cancer for that matter, there is no cause. There is no cause. So we put it as risk factor.
Yeah.
Risk factor is different from a cause.
Okay.
Cause means if the reason is there, that cancer has to happen.
Okay.
But that is not the case in all the cancer, majority of the cancer in the body. So they are called risk factors.
Okay.
The most important risk factor in colon cancer is our hereditary.
Okay.
Around 15-20% of colon cancer, what we see in our day-to-day practice, they have some form of familial or hereditary risk factors, like the close first-degree relatives, like parents or siblings. They might have had cancer in the early stage,
Okay.
and then these people getting cancer. It's more often hereditary.
Okay.
15-20%, but 80% is still we don't know the cause.
Okay.
Risk factors are there, like eating excessive red meat or a processed meat, what we call it,
Yeah.
stored in
Yeah.
the refrigerators for months together. So this has been proven by the research that it's a class 1 risk factor for colon cancer.
Okay.
The red meat and the processed meat.
Okay.
And low fiber in the diet also causes colon cancer.
Okay.
Because when you consume less fibers in the diet, the transit time is more.
Okay.
So the bacteria can convert some of the toxic chemicals into pre-malignant carcinogens.
Okay.
So low fibrin diet is also a known risk factor for colon cancer. And similarly, age, as we age, the chance of any cancer in the body increases. So like colon cancer.
Okay.
So there's something called as a polyp. Everything in the colon starts as a polyp.
Okay.
So not all polyps are cancerous,
Okay.
but if some polyps which persist for longer duration if untreated, sometimes they can transform into a cancer. So it's always better to undergo screening like colonoscopy after certain age, like 45 or 50. In fact, screening guidelines in the West say after 50 everybody should undergo screening colonoscopy after 50. But people who have family history or a strong genetic risk factor, like family history, they should undergo 10 years prior to that, like at the age of 40, 45. If you start undergoing the screening, you can at least pick up some patients in early stage and cure.
Okay, see, like other cancers, like other diseases, what are the symptoms, sir?
Unfortunately, early stage cancers are asymptomatic. 90% of stage 1 cancers do not have symptoms at all. And especially colon cancer, because it's in the abdomen, and some actually there will be symptoms, but majority of us will ignore it and take over-the-counter medication, go to a medical shop and take some painkillers or some laxatives, and we just cure it off.
Okay.
So 90% early stage cancers are asymptomatic. Whenever the patient comes with the symptom to us, that means he's in stage 3 or stage 4. Unfortunate.
So after getting symptoms, there is a chance of for third or fourth stage.
So symptomatic cancer anywhere in the body will be either stage 3 or stage 4. We have seen in our day-to-day practice. So we should not wait for the symptoms. And one of the early symptoms is altered bowel habits. Most of us do not have the habit of checking what we are excreting in the morning. Just we sit in a commode, flush off and come out. We don't see what we have excreted. We don't feel good also, maybe that reason. But then there will be some changes in the bowel habits, like blood in the stool, or dark colored stools, or mucus in the stool, or the consistency of the stool has changed, and frequency of stool has changed. So any subtle thing, not all diarrheas, all constipation are dangerous. I am not telling that. But then whenever there is a change in your routine bowel habits, so probably it's time to go and evaluate yourself. Go to a surgeon or a physician, where they can order some of the tests like routine, your ultrasound abdomen, or a stool blood test, occult blood test we call. Some investigation, it has to be initiated, like CBC, a simple blood count like CBC, hemoglobin, can pick up colon cancer. A patient, young, healthy patient having hemoglobin of less than 8 or 7, there should be a reason why that he's bleeding somewhere. So when we evaluate, sometimes we find colon cancers in these patients. So simple blood test can also pick up, but more importantly, we should know our body. We should listen to our body. So we know what is normal for us. Any change in that, like slight pain, change in our bowel habits, consistency, frequency, then probably get alarmed. Don't worry, but then go to a physician and tell that this has been happening since a week or 2 days, 3 days, that way, so that they can pick up early. Picking up early is the only cure in cancer, to be frank.
See, what are the tests or diagnosis methods using for this one, sir? Sir already mentioned about blood test.
So
rest of them.
Specifically for colon, the best investigation is colonoscopy. It's pretty sensitive. Almost 90 to 100% of the lesions in the colon can be picked up by colonoscopy. It's a basic, simple test.
One day procedure. That one, no need of admission.
It's a daycare procedure. So no admission needed.
Nothing.
You can get yourself prepared in the home itself. They'll tell how to prepare your bowel. They'll give some laxatives which you have to consume 1 day prior. And don't consume anything on the day of procedure in the morning. And then they do under IV sedation. But many of the consultants do it under without anesthesia also. It's painless basically. And pretty effective in picking up all these colon cancers. So once they see something in the colon, like unhealthy mucosa or an unhealthy polyp or a suspicious growth or something, they'll take a small biopsy from that growth, and then they'll go for the testing for the histopathology. By normally 2 or 3 days, you should be able to get a report of what exactly it is. So colonoscopy and biopsy is the best investigation to diagnose colon cancer.
Okay.
And the next important test is your CT scan, imaging. So to know where all it has spread, like from the colon, initially they spread to the lymph nodes. Firstly spread to lymph nodes. From there, if they escape that, they go into the bloodstream, and from there they go into the lung, liver and bone and other organs.
Okay.
That's stage 4. So to know what stage this patient belongs, after the scopy and the biopsy, we usually order a CT scan.
Okay.
That's called a contrast CT scan of the thorax, abdomen and pelvis.
Okay.
So that will give an idea of whether the size of the lesion, how big the lesion is, and whether it's gone to the lymph nodes or not,
Okay.
and whether the liver is normal or in lesion in the liver. From the blood it could have gone to the liver, lung and bone and all other organs. So to appropriate stage before surgery, we use the help of a CT scan.
Okay.
There's something called PET scan, which is not mandatory for an initial stage. Stage 1 to stage 3, we don't need PET scan.
Okay.
Whereas if you have a doubt of stage 3 or stage 4, some suspected lesion in the liver,
Okay.
which we are not able to pick up on a CT scan, and the surgeon has a doubt.
Okay.
Or sometimes there's something called as a blood marker, serum CEA, tumor marker. If it's extremely high and CT scan is showing normal, in that conditions we ask for a PET CT scan. So it's just like a CT, but additional dye injected into the body. The sensitivity is a bit more than normal CT scan. So when we have a doubt of stage 4, we order a PET CT scan. Otherwise, CT is sufficient.
Okay, so here is a hypothetical question, sir. See, suppose one person got a colonial cancer in stage 1. How long it will take to get to stage 3 or 4? I don't know exactly what I think of this question.
What study says, from the normal polyp to a cancerous polyp,
Yeah.
the timeline, around 8 to 10 years.
8 to
So
10
long,
years.
so long.
Okay.
From a polyp to turn into a cancer, it takes 8 to 10. That means the disease gives you so much time for you to go and evaluate.
Yeah.
And we are wrong if we don't do that.
Okay. That disease itself give more
So
time
much
for
time,
us.
That's why the guideline says the scopy has to be done once in every 10 years.
Yes.
At the age of 45, if you do, the next scopy you can safely do it at 55. And similarly the next of 65. So timeline, what they say, from the polyp to the cancer is 10 years.
Okay.
But from stage 1 to stage 3, there is no fixed time.
Yeah.
Once it becomes a cancer, we have seen patients from stage 1 to progress in stage 4 within 6 months.
Yeah.
And some patients stage 4 living for 4 to 5 years.
Okay.
So it all depends on many factors: the genetic makeup of the cancer, genetics of the individual per se, response to therapy,
Okay.
and so many factors.
Okay.
Internal environment, how the body responds, all those things. So from stage 1 to stage 4, there is no fixed timeline.
Okay.
What we have studied is from the polyp to the cancer.
Yes.
It's around 8 to 10 years. It's a big time where we can intervene and cure many of the patients.
Okay.
So that is important.
Okay, sir. Let's come to the treatment side, sir. What are the treatment options?
Yeah, any cancer care, modern day cancer care, when we speak of, it's all about multidisciplinary approach. I would be wrong if I say that I as a surgeon can cure all cancer, colon cancer patients. Definitely no. It's all about multidisciplinary. So whenever a patient walks into our OPD or in our cancer center, we do all evaluate first. We do a scopy, biopsy, CT scan, and all these tests go to all the consultants. Like I'm an oncosurgeon. Similarly, there's somebody called a medical oncologist who gives chemotherapy. There's a radiation oncologist. There are pain and palliative. So all the doctors sit together, and then this case profile is discussed as to what is the best treatment we have to follow. So as any other cancer, like surgery, chemotherapy, immune and targeted therapy, these are, and radiation. These are the basic treatment modalities available, which we use in that permutation combination based on whatever stage they come to us. For example, stage 1 colon cancer, majority of the patients can be cured only with surgery. Stage 1, they don't need chemotherapy at all. Okay, and when
so any other cancer, if it is stage 1, first option is surgery, sir.
No, I'm speaking of colon in particular.
Only
colon in particular. Stage 1. Like suppose stage 1 vocal cord cancer, I need not operate. Voice box cancer stage 1, we straight away refer to radiotherapy. Only just with radiotherapy, patient can be cured. He'll have his voice back, all normal activities now. Whereas if I operate, he'll lose his voice. So it's particular to particular cancer. So when we speak of colon cancer, stage 1, surgery is the treatment which can cure 90 to 95% of the patients.
Yes.
Okay, they don't need chemotherapy, no radiation, nothing.
Okay.
And from the stage 2, again we categorize the stage 2 high risk and low risk.
Okay.
So stage 2 low risk patients, again no role of chemotherapy. We just keep them under close observation every 3 months.
Okay.
Whereas stage 2 high risk, there are some criteria where we say high risk. These patients, they need chemotherapy. Sometimes 4 months to 6 months of chemotherapy is what we advise after surgery.
Okay.
Stage 2.
Okay.
The stage 3 colon cancers, they invariably need chemotherapy. So first we operate, either it could be a right hemicolectomy, left hemicolectomy, whatever it is, depending on the location. And then chemotherapy for 4 or 6 months, depending on the pathological criteria.
Okay.
If they're lymph node positive, then we tell them to take chemotherapy for 6 months.
Okay.
And stage 4, unfortunately, we can't cure. We can't cure. But we can prolong the lifespan by modern chemotherapy and immunotherapies. So, of late, what we have seen is immunotherapy is talk of the town. Many of the people ask, what is immunotherapy, sir? And cost and all those things that way. So, immunotherapy is something in the trial basis now. So, for stage 4 colon cancer, we have found some good results with immunotherapy. So, 15 to 20% of this colon cancer, they have something called as MSI high.
That means?
That's called microsatellite instability. We test on the biopsy.
Okay.
So when these patients express MSA high, these are the patients who do respond beautifully to immunotherapy. So much so that we have some people have been cured with immunotherapy only without any other treatment.
Okay.
Especially when they are MSA high.
Okay.
Okay. Or we call DMMR, deficient mismatch repair protein. So these are subset of patients which are very few out of 100 of stage 4. 15-20% are only this MSA high. But if they are MSA high, the response to immunotherapy is excellent.
Okay.
They get cured, sometimes we can prolong to 4-5 years. Stage 4, living 5 years is actually a good thing because before they used to die within 6 months, stage 4. Now we are able to push the lifespan up to 5 years
Okay.
with immunotherapy.
See, those who got first stage, the cancer is first stage, treatment is gone. Okay, whether it is a radiation, so whatever may be, radiation or surgical or chemo, whatever may be. See, after that, any chance to getting back this cancer?
Yeah, the study says stage 1 cancer cure rates are 95%. 95.
There
That means that 5% of patients we cannot predict. So that's the reason we keep all these patients under strict surveillance. Follow. Every 3 months we ask them to come with the serum CEA, that's a tumor marker, and every 6 months we do ultrasound of the abdomen to check anything, recurrence, local recurrence, liver and all those. As we step up the ladder in stage 2, the cure rates are around 80%. That means 20% still have the chance of coming back in. That timeline we don't know, sometimes 6 months, 1 year, 2 years, some people get back after 5 years also. That we can't predict. That's the reason we keep all these cancer patients, stage 1 also, under follow.
Okay. See, sir, before getting this one treatment and what the early detection is already explained that what is early detection. Okay, like that, what are the simple methods? Just abdomen scanning and blood test. It is enough for early detection. For screening is actually what is that? See, people will get attention also that for screening, they may panic because we are getting cancer. That's why some camp is there. That's one. Suppose women and even men, they are not coming for camp, especially oncology camp. What is the reason that they are telling that we are getting attention? Because now we are so okay. After see the camp, then any symptoms will come, we will get attention. What is the advice for that viewers?
Yeah, that fear is for many of us actually. We are healthy, why should I undergo a colonoscopy? If I get something in that, then probably the treatment and all this.
Some symptoms are seen again, will get attention.
But then there is no absolute guideline in India, skin guideline, like in the West. In the West, if you don't undergo colonoscopy, your insurance is not renewed after you're 50. So that's strict and stringent it is.
Though all the patients, they should go there.
Go there and insurance covers. And insurance covers major of the screening programs. But in India, unfortunately, we don't have the guideline, and the insurance companies do not cover all these things actually. So it's like opportunistic screening, what we call. Whenever a patient comes to us, we tell them, okay, if you're age of 50, probably you undergo a colonoscopy. It's always better. We try to counsel and convince, especially after 50. But then, as you know, fear. If we do a scopy, if it all, that's definitely there. Many of the people don't agree for. Unless people who have a strong family history or suspicion that they may get cancer, parents have a malignancy in the colon, they usually agree for. They agree for screening. But others, routine population, when we advise screening, many of them they don't, because of the fear that if we pick up something in that, then probably my life changes. But it's not the fact. If you pick up in an early stage without symptoms, you can cure these patients 100% of the time.
Okay.
Yeah.
Sir, see, we have discussed already discussed about colon cancer and its diagnosis and treatment. Everything is regarding rectal cancer also same.
The slight change in the management of rectal cancer actually, because of the anatomy. As you know, rectum is the last part of the intestine where we pass motion as the area. So the chances of the rectal cancer spreading to the lymph nodes is pretty fast and high.
Okay.
So that's why whenever the patient comes to us, they are majority of the time stage 2, stage 3 rectal cancer patients.
Yes.
So in rectum, the guidelines is stage 1 you can directly operate, stage 1, which you rarely see in Indian population.
Okay.
So we see in stage 2, stage 3. So almost all the rectal cancer patients, initially we give chemoradiation.
Okay.
So we downsize or shrink the tumor and then we operate.
Okay.
So that's the difference between rectal and the colon. Whereas colon radiation is not mandatory.
Okay.
But for rectum, stage 2, stage 3, it's mandatory that we give
first
chemoradiation.
chemoradiation,
then operate.
Then surgery.
Correct.
Okay. Yeah. So see, any preventive method is like other. So there is a chance of see, viewers are expecting any other preventing method for cancer. So see, most of the times when we are wind up the program, all the disease, these are the preventing method. Like a cancer, any tips?
Yeah, to be frank, we can't prevent any person from getting a cancer.
Yes.
If he is genetically prone or his lifestyle, we cannot. The best we can do is pick up early. As I said, screening, colonoscopy, 50 at the age of 50th birthday, you tell that okay, I'm going to get a colonoscopy for my family, or my family, my parents, whatever it is that way. So that's the best way to pick up early.
Yes.
Prevention, we can speak long, like lifestyle. Lifestyle is more of like on a speech we say you should do that. But how often do we follow in our day-to-day practice is very difficult.
Okay.
But there are studies have shown that daily exercise like routine walk, brisk walk in the morning and 1 hour a day for 7 days a week. And consume less alcohol as anybody, less alcohol, less red meat, no smoking, all good lifestyle what we can, if we can follow, I think major the cancer we can prevent.
Okay.
But as I said, screening is one important thing which can pick up cases in an early stage and cure. Even if you have cancer, you can get cured.
Okay. So screening is the best method.
Preventive measure.
Preventive
The
measure.
best,
Okay.
definitely.
So I think
And lifestyle.
that sir
Try
already
to
mentioned.
keep your weight under whatever norms are there.
Okay.
And don't eat stored frozen food, red meat, processed meat, and high carbohydrates in your diet also can be a risk factor for obesity, which can cause cancer.
Okay.
And be active, be happy, and do good.
Yeah.
Basic principles in life. So I think by doing this, you can prevent majority of the things.
Okay. See sir, in treatment methods, sir is already mentioned that surgical procedure. What are the new surgical procedure we are applying?
Yeah, of late we are doing many of these cancer surgeries in a minimally invasive surgery we call MIS.
Okay.
That means it's a laparoscopic keyhole procedures. And now in our center we have a robo as well. It's called Da Vinci robo.
Yeah.
So many of these procedures which were done previously by open method, which is painful and all. Now we are doing it laparoscopic. The main benefit laparoscopy and robotic. Robotic is especially beneficial when it goes to rectal cancers because it's low down in the in our anatomy. So for as a surgeon, rectal cancer is always better treated with a robotic platform.
Precisely, you can.
Very precise, accurately, less blood loss,
Okay.
less damage to the normal structures, and quick recovery. No blood loss, and the patient can be discharged in day 4, day 5 with the major surgery as well.
Okay.
So that's the benefit of a robotic platform for rectal surgeries.
Okay.
So yeah, from open surgery now we have slowly evolved to laparoscopy and now robotic surgery.
Okay.
So this is the main development which has occurred in colon cancer surgeries.
Okay, sir. So that new method, see, robotic surgery, then patient can easily see how long it will take sort of staying in hospitals for robotic surgery.
Depends on individual case actually. But majority of these laparoscopic and robotic surgery patients, they do get discharged in 5 to 7 days. Within a week, you can discharge the patient home.
Okay, all these options are all these treatment and treatment options are in AJ.
Yeah, we do have.
Cancer center, sir.
We do
here,
have
sir.
all holistic. There's a separate dedicated cancer center in AJ,
AJs, yeah.
where we have medical oncologist, surgical, radiation, pain palliative, and diagnostics like PET scan also is available.
Yeah.
And we have a latest robo as well, and all laparoscopic setup, everything is available. So holistic approach is definitely available in our center.
Okay.
Yeah.
Okay, sir. Oh, so we have discussed broadly about colonic cancer and rectal cancer causes and treatment, diagnosis method. Okay, various treatment in, especially in robo is also used for surgical. Shall I wind up the program, sir?
Yeah, definitely.
Okay. മെഡിട്രാക്കിൻ്റെ ഇന്നത്തെ എപ്പിസോഡ് ഇവിടെ വൈൻഡ് അപ്പ് ചെയ്യുകയാണ്. ഈ എപ്പിസോഡിൽ കാസർഗോഡ് വിഷൻ്റെ പ്രേക്ഷകരോട് സംസാരിച്ചത് മാംഗ്ലൂർ AJ ഹോസ്പിറ്റൽ ഓങ്കോ സർജൻ ഡോക്ടർ വിശ്വനാഥാണ്. എല്ലാ പ്രേക്ഷകർക്കും നന്ദി, നമസ്കാരം. താങ്ക് യു, സർ.